Bismillahirrahmanirrahim. Assalamu alaikum. This session of pro and cons debate is on artificial intelligence. Artificial intelligence in healthcare and research. Will the artificial intelligence enhance or undermine the human potentials? We have two chairpersons here for this session. First, I'll invite Dr. Hamidullah from Khan University Hospital. He is a faculty member and he looks after intensive care and anesthesiology. Second chairperson is Professor Zahid Akhtar Rao. Professor Zahid Akhtar Rao is chairman of anesthesiology, critical care and pain management, director postgraduate medical education, Fazaya Rutfa Medical College, Karachi, former HOD of anesthesiology and critical care, Bahriya International Hospital, Karachi, Shaheed Mohtarma Benazir Bhutto Trauma Center, PNS Shifa, President PSA Karachi, and holder of Lifetime Achievement Award.
Our first speaker is Dr. Muhammad Arslan Jamil. He is FCPS in Obstetric Anesthesia Fellowship, Senior Registrar, Department of Anesthesia, Surgical ICU and Pain Management. Dr. Arslan Jamil.
Assalamu alaikum. My name is Dr. Arslan and I am from Civil Hospital Karachi. I am working there as a senior registrar. So the topic of my today's session is pro about artificial intelligence. Will it enhance or undermine the human potentials? So with the name of Allah, I will start my today's presentation. Bismillahir Rahmanir Rahim. First of all, I have no financial disclosures or any conflict of interest with the material presented in this presentation. And I would like to start my presentation with this image that is showing that if we incorporate the human mind with the AI, so there will be brightness all around if we are talking about healthcare and research. And first of all, what is artificial intelligence? It is a broad concept that one designs a machine that understands and performs tasks on their own in a smarter manner. And it can be thought of programming computers to stimulate cognitive functions of the human mind, such as pattern recognition and problem solving. So there are types of artificial intelligence that are weak AI, that focuses on the task that cannot be performed beyond its limitation. There is a strong AI that can understand and learn and intellect tasks that a human being can. So that researchers are striving for about searching for a stronger AI, and there is another one that is super AI. That is, its intelligence will surpass the human's intelligence and can perform any task better than a human, and it is still a concept. So this slide of mine is showing that as far as AI application in the healthcare, there are multiple pros and pros all around this slide. That is patient care, medical imaging and diagnostic, and physicians and research and development. All the areas are being held by the AI. And if we talk about patient care, then automated and assisted diagnosis and treatment, real-time patient prioritization and triage can be done easily by AI. And there are multiple apps that has pregnancy assistance that can track and remind the maternal alarms, and health assistants and personal trainers. And as far as medical imaging is concerned, error-free diagnostic results are being achieved with the use of AI. Intelligent symptoms analysis has also been a part of it. Predictive and early diagnostics and radiology assistant are being used by the radiology people, and diagnosis via the medical imaging. So if we talk about surgeons and physicians, then surgical robots are being one of the machines with AI algorithms built in them, and they are helping them in a great manner. And personalized medical medications and care and clinical trials all are being a part of AI, which the physicians are using these days. And research and development is another part that is a real thing that is using AI these days, and it involves data mining, analytics, drug discovery, drug design, pandemic detection apps are there, and vaccine development. So how does the AI is helping the healthcare and research? That is, it provides real-time data, streamlines the task, saves time and resources, assist research, reduce the physician stress, and 24/7 availability of the app or software, whatever the thing is being used, and perform repetitive tasks without getting bored or without losing the focus while doing the first task. And reduction in the human error is one of the reasons that AI is being there. So I have found out an article that is Artificial Intelligence and Anesthesia. This was a narrative review that was published in the Saudi Journal of Anesthesia. It is a very good review discussing some really innovative AI tools, and that could be the future of AI and anesthesia. So I would request my participants to look at this study as well. And what this study was all about, that there are use of robots in anesthesia, and the one of the example of that is target control infusion systems that we are using it, but it's an open loop and first generation system, and the AI is now moving the taking the things more forward and ahead. That is, initial models were single input and single output systems, means you enter a single value that you want to achieve a plasma concentration and you start an infusion, and there is no check and balance by the pump as well. But now there are more and multiple systems, that is, you give multiple inputs to take multiple outcomes from the single machine. That is the recent advances. So what I found out that there was a study that was done in anesthesia analgesia in 2017 that was a RCT, that closed loop feedback computer controlled phenylephrine infusions were used to maintain the blood pressure during spinal for cesarean section delivery. And this was a randomized control trial comparing the automated boluses versus the infusions. And the automated boluses that were given were by the software detecting the arterial pressure via AI and giving boluses at the right time and the right limit. So they found out that BP control was more precise when the computer controlled phenylephrine drug delivery and intermittent boluses rather than the continuous infusion were given to the patient. So the use of the intermittent boluses may be a useful alternative in the design of closed loop vasopressor systems. Means we are in an era that there are closed loop systems are coming more, and we will be then away from that TCIs and open loop systems. Another study that I found about was that it is not a new thing that AI is coming into the anesthesia field. That is robotic assisted airway was achieved by us in a simulated case in 2012, and they do this by using the Da Vinci robot, and they use this on a mannequin and use the bronchoscope to intubate the patient by using the robotic arms. And what they found out was really beautiful, that the view that it was the aim, that this view was the aim of the researchers, that how early they could achieve it. So they found out that during oral intubation it just took them 75 seconds, and to take the bronchoscope tip from oropharynx to the carina, and in nasal intubation it took about 67 seconds to go to the carina. So it was a really good thing. But in 2012 it was very early, and Da Vinci arms were really troublesome for the performers. So what they do, they bring into another system that is known as the Kapler's intubation system. What they really did in this system was that they connect a video laryngoscope with a robotic arm, and then they notify the time that a single arm, just like a human arm, takes 40 to 60 seconds. And it was for the areas like battlefields in COVID where people avoid to go and intubate, so a robot can do things, and patient care can be continued by using AI and AI algorithms. So it was very beautifully depicted in this study as well. And another thing that I found out, that anesthesia is, everybody knows we are people with gadgets. So comparison of success rate and learning curves and inter-subject performance variability of robotic assisted and manual ultrasound guided nerve blocks needle guidance were used in simulation labs. So what they found out was they attach a robotic needle, they attach a normal needle, a block needle, to a robot, and they made the student practice, and the results were very, very good, that robotic assisted nerve blocks allow faster learning of the needle guidance and over manual positioning, and reduces the inter-subject performance variability as well. So it might be the future of anesthesia, and pros are everywhere. So another study shows that accurate classification of difficult airway intubation by computerized facial analysis. There was an AI algorithm designed when the intubator intubate the patient, the AI and the software by a camera take the facial features and all the Cormac Lehan and all the things, and what they found out was really beautiful, that computerized analysis of the facial structures and the thyromental distance can classify easy versus difficult intubation with accuracy significantly outperforming all the other clinical predictive tests. So that was really beautiful. And American Society of Anesthesiology has published in February 2020 in their 132nd volume that robotic anesthesia will be available soon. This means that what they found out that there are 6 themes of our anesthesia applications where the AI can make a difference. That is depth of anesthesia, control of anesthesia, event and risk prediction, ultrasound guidance and pain management, and operating room logistics as well. So lastly, the revolutionizing of the healthcare and the role of artificial intelligence in the clinical practice this was a BMC article that was published in September 2023, and it clearly shows that they use PubMed, Medline, Scopus, and Embase, all the article database and collected all the articles that were exploring the questions about use of AI and in their application. So they published all the articles that were published in the English language. So they found out a conclusion that surely AI can be used in diagnosis of disease, personalized treatment plans, assist clinicians with the decision making, but they also wrote that human expertise must be addressed for the responsibility and effective implementation of the AI in the healthcare really require vigilance and control of human expertise over AI. So in summary, I would like to add that prompt adoption of the technology has been a hallmark of our field. Anesthesia people really introduce every gadget in their field as soon as possible. So responsible for the significant increase in the patient safety in this specialty over the last few decades. Now AI has been all around, and we need to understand the benefit of the AI that can bring to the clinical care. It aims at assisting the clinician and not replacing them, because it was in my mind that when the debate will start, people will be calling that, do you want to replace us? So the answer is no. It will be our helper. Okay? The helper that aids us many a times better, and there are many multiple input, multiple output. That is the MIMO systems in making that will surely aid the anesthesiologist in giving the perioperative critical care, pain management services with more accuracy even before. So thank you, and that's the thing we will be seeing all around.
Thank you very much, Arsalan.
Yes.
Very well presented pro debate for the for AI in healthcare and research. To present counterbalance for this topic, I'm inviting Dr. Furqan Haider, who's a consultant anesthesiologist and in charge anesthesia at the Sindh Infectious Disease Hospital, as well as Cancer Foundation Hospital. He is a fellow from Indus Hospital. Dr. Furqan.
Assalamu alaikum. Thank you so much to the scientific committee that give me opportunity to express my thought on the cons of artificial intelligence. So our disclosure method, I have no conflict of interest except promoting the medical education, and this is my roadmap that I'm going to talk in my next few minutes. So AI, that is, the Arslan is already told that's the human brain and that's controlled by artificial intelligence. So Arslan is already defined what is the AI, the ability of computer system to perform 8 of problem solving, reasoning and learning. And it is an emergent technology that is potential to enable multidisciplinary innovations. And independent learning is most important because it mitigates the need for human interventions. So what is difference between AI, machine-based learning and deep learning? AI is a big picture. It's a big umbrella. that develop the smart system in machine that carry out the tasks that typically require the human intelligence, and machine creates the algorithm that learn from the data and make decision based on patterns observed. And deep learning, that is the actual target that we should use our artificial neuronal network to reach the accurate conclusion without human intervention. So this is the difference between these two. Already mentioned what is AI in healthcare. Arslan has a thorough review about it. That should be the patient-centric workflow optimization and behind the scene, and a lot of examples that Arslan has already quoted. So history of AI and anesthesia, that what we are using that in anesthesia right now in the AI, that is dye pre-freezer system, propofol target control infusion system, closed loop anesthesia drug administration, and what is cognitive report anesthesia, that is anesthesia information and management system. What it can help in pre-operative evaluation, assist in intraoperative monitoring, and highlights the key changes, and help clinician by providing a clinical decision support system, help in research, quality assurance, and accurate billing of the patient. And what is smart anesthesia manager, that improve compliance to the drug like intraoperative antibiotics and intraoperative beta blocker therapy, and decrease inadvertent gap in patient's monitoring, and improved billing of the procedure done. So these are the systems pharmacological model that already we are using, dye pre-freezer, closed loop anesthesia, max sleep, and all these that Arslan already focus on these things. And the mechanical robots that what we are using, Da Vinci system used for fiber optic capillary intubation, and one is robotic endoscopic automated via laryngeal imaging via tracheal intubation, and some sort of this. Now coming to the cons of artificial intelligence in the healthcare and research. So obviously the system that we have used that have the pros simultaneously, there are some drawbacks that need to be negotiated before using the technology. One is data collection and algorithm developing concerns, ethical concerns, social concerns, and clinical implementation concerns. So injuries and error, that is the most obvious risk. What can AI? AI can recommend a wrong drug for the wrong patient, fail to notice a tumor on a radiological scan, and allocate a hospital bed to one patient or another, because it's obviously a machine-based technology. And the concern is that errors are routinely done by the human efforts too. So what is difference between the AI-related problems and that the errors that occurs because of the human effort? The AI-related problems are different in respect because the patient and providers may react differently, and AI system is widespread. One AI might injure thousands of patients. Or the data availability, what are the cons? Because the training AI system required a large amount of data from different sources like electronic source, pharmacy record, insurance claim records, or consumer generated records. And they are typically fragmented data that can be spilled and because it can derive from multiple systems and multiple formats. What this fragmentation do, this will increase the chances of error, decrease the comprehensiveness of data sheet, and increase the expensive of gathering data. And the privacy concern. The requirement of a large data set create incentives for the developer to collect such data. Some patient may be concerned that this collection may violate their privacy. AI can predict the information about the patient even through the algorithm never received the information. For example, I have quote an example that I have derived from one study that an AI might be able to identify a patient has a Parkinson disease based on the trembling of the computer mouse, even if patient has never revealed this information to any else. So biasness and inequality. If AI system learn from accurate, responsible data, there are still problems that can lead to the biasness and inequality. One example that I have quote that I have derived from one study that an African and American patient receive on average less treatment for patient than white patients. An AI system learning the health system record might learn to suggest lower doses of painkillers to the African American patient, even that their decision reflect to the systemic bias, not the biological bias. So this is one of the drawback of the AI, that how it trains, what sort of algorithm that are designed, and what are the different experiences that leads to the formulation of this that can leads to the biasness and inequality. Resources and allocation in AI system could also exacerbate inequality by assigning fewer resources to patient considered less desirable or less profitable by health system. So professional realignment. Long-term risk involves shift in the medical profession. Some specialties such as radiology are likely to save substantially as much of their work become automable. And one example that I have quote here that some scholars have concerned that widespread use of AI result in decreased human knowledge and capacity over the time. Such that providers lose their ability to catch and correct the AI errors and future to develop medical knowledge. That's the very much significant concern of the AI, that if we created the machines based on the automatic algorithms, who is going to catch this machine when the errors are being done? Because that is the completely professional realignment. Mean will not be trained enough. They will be rely on the machines, and what will be happen? This is the serious concerns that is one I have highlighted over here. So limitation and ethical consideration of AI in anesthesia. AI system required high quality data to work efficiently, especially those built on machine learning and deep learning. It is quite difficult to guarantee the accuracy, thoroughness, and consistency of data collected from various sources like anesthesia machines, patient monitors, and electronic health records. Patient safety may be jeopardized by incorrect AI algorithm caused by incomplete or faulty data. Enormous amount of data raise the concern of privacy and security. It can be inaccurate prediction or recommendation that can have an improperly developed or if have been trained on the bias on unrepresentative data. So the one concern, another concern that I have highlighted over here, that AI system lack empathy and human judgment, both of which are essential in healthcare industry. For example, depending on patient's data, an AI might suggest a certain anesthetic strategy, but it cannot take into consideration patient concerns or anxiety regarding the treatment. That is very important, that what we can miss while using the gadgets and the machine. Several legal and ethical issues are brought up by the usage of AI. For example, if error has done by the machine, so who is going to be in charge of this mistake is made by AI? Who created the system? The anesthesiologist who prefer to use it, the programmer who created it, or the hospital that put into its use. Patient consent, and as another ethical issue, patient must be aware regarding the pros and cons of the AI and given an alternating option if they are unwilling to do so, because these are the inaccurate, loss of empathy, and ethical and privacy issues we must know. So summarizing my presentation, so whenever we are using the AI, the ultimate goal of our care is that to promote the safe anesthesia delivery, that having the element of the empathy and proper so protecting human autonomy, protecting human well-being and safety in public interest, ensuring transparency, explainability and intelligence, fostering responsibility and accountability, ensuring inclusiveness and equity, promoting AI that is responsible and sustainable, and that is the future of research. Thank you. These are the references.
Thank you very much. Although there is no provision for any questions in the program, I take, with the permission of the scientific chair, this liberty to invite only 2 questions from each speaker, 1 question from each speaker. Please. नहीं है question.
Of course, the world is progressing, and so is everything else. But we cannot forget that this human brain is made by God, and the artificial intelligence brain is made by a man, made by God. So I don't think it will ever be able to reach what God has given us. One. Secondly, पाकिस्तान में तो खैर अभी we are way back. अभी हम तो यही डिस्कस कर रहे हैं कि हमारे MSDA होना चाहिए या सिर्फ FCPS, MCPS होना चाहिए. So we are way behind. But I think it was a very interesting topic to have been introduced to sensitize people that something like this is also happening in the world. मुझे तो फुरकान की बातें ज़्यादा अपील की rather than अरसलान की बातें. But that's my personal opinion, of course.
So the topic was whether AI would enhance or undermine the human potential. It would definitely enhance the human potential. आप भी मेरा ख्याल यही कह रही हैं कि वो हेल्प तो करेगा ही ह्यूमंस की.
जी, only comment. Both presenters are very good, and you see, we cannot deny to follow the artificial intelligence scenarios in different gadgets and research and anything most. But it cannot replace the human intelligence. As to me, it is not artificial, not intelligence. It is the only data which is provided to the machine. It is analyzing that data. And in this part of world, in Pakistan, we don't have such data that if we put our question in our scenario, that can analyze. Many times I have put the questions regarding the Pakistan to the artificial intelligence, but they said we don't have a data from Pakistan. So both are very good. I think we have to use it very carefully, and human intelligence is above it.
Dr. Safia?
On lighter mode, फिल्मों में तो ये दिखाया जाता है कि आर्टिफिशियल इंटेलिजेंस ने ह्यूमन पे कब्जा कर लिया. फिर क्या होगा? अगर आर्टिफिशियल इंटेलिजेंस इतना ज़्यादा हो गया तो हम तो कहीं के नहीं रहेंगे. हमें कोई रिप्लेस नहीं कर सकता. एक बात और मैं कह दूं कि अभी पहले कोई फेयरवेल हर जगह आई एम श्योर एवरी डिपार्टमेंट हैज़ गॉट अ ग्रुप एंड सो डू वी नाउ इन माशाल्लाह सबकी लैंग्वेज तो है प्रॉब्लम है. अब जो आते हैं फेयरवेल नोट्स ऐसे लड़कों के जो कि पूरी अपने हिस्ट्री उर्दू में लेते हैं, उनके ऐसे वेल रिटन नोट्स आते हैं कि आई एम लीविंग एंड मे गॉड बी विथ यू एंड दिस एंड दे आर ऑल एंड इट्स चैट GPT. सो आई थिंक हम लोग अपने ब्रेन को स्टॉप कर रहे हैं. पहले सारे टेलीफोन नंबर्स याद होते थे. नाउ टुडे आई डोंट रिमेंबर व्हाट इज़ द नंबर ऑफ हमीदुल्ला. पहले मुझे रटा हुआ होता था इसका उसका सबका. सो आई मेरे ख्याल से देयर शुड बी सम प्लेस वेयर वी पुट अ स्टॉप टू दिस आर्टिफिशियल थिंग्स एंड स्टिक टू आवर ओरिजिनल ब्रेन्स.
This is the last comment.
Thank you, Dr. Hamid. Acha, I have a comment and question. The comment is that I agree with you. No one can replace the human. Actually, so is our life. Okay. So my question is, what are the AI model currently we are using in Pakistan related to anesthesia?
कुछ है तो बता दें.
If any systems have TCIs, target control infusions, they were the first things that being the system that has a software inbuilt, they have a model inbuilt. You have to run a target control infusion, and you just don't know, have to have the knowledge of that. What is the model running behind? It's the Schneider model or the Marsh model. So these are the things we are currently having in Pakistan. If any system is having TCIs, otherwise further models and further things are not that much in.
Just
Another thing I must add that whatever the ventilators we are using nowadays, the Hamilton C3 and C6 that have intelligent mode of ventilation, that are also AI-based mode of ventilation that automatically know what is the compliance and what is the pressures and what is all these things, and they automatically adjust the patient's ventilation according what they have received the data from the patient. This is also one of the great example that nowadays we are using it.
हम सिंगल इनपुट सिंगल आउटपुट तो है, लेकिन आई डोंट थिंक वी हैव एनी मल्टीपल इनपुट मल्टीपल आउटपुट सिस्टम्स इन पाकिस्तान. So to conclude from my side, this is one of the best pro-con debate I have ever heard, जिसमें किसी ने किसी के साथ कोई ख़ास इख्तलाफ नहीं किया, एक दूसरे को सप्लीमेंट किया और अपने अपने पॉइंट्स वादे किए. सो थैंक यू वेरी मच.
Thank you, sir.
Now I'll invite for the certificates. Dr. Tipu is here, so I'll invite him for the certificate distribution. Thank you. Thank you.